So, Mom and Dad, did you change the baby this morning already before breakfast? And what about Grandpa? Well, the reality is, at both ends of the age spectrum, the same thing is going on. And Dr. Angela, excuse me, every time you're on here, I just keep thinking, you're not only an extremely skilled doctor, but you're also funny.
Well,
Dr. Angela,
coming from you, that's an honor.
Dr. Angela DeRosa, in private practice here, number of locations.
Yes, all across the valley.
How many?
We have 4 locations: Glendale, Chandler, Gilbert, and Scottsdale.
Most of the time we ask our guests to mind their P's and Q's.
Not
but
me.
At this time you can just go ahead and forget the Q's and concentrate on the P's.
Ooh.
How many people, I don't mean by number, but how common is incontinence?
Urinary incontinence is incredibly common. I probably would have guessed, if I anecdotally looking at my practice, about 70 to 90% of people that come into my practice over the age of 30 and 40 have some degree of urinary incontinence.
Over the age of 30 or 40?
Yes, in particular women. Men, it's a little bit later, but women, because we pop out those babies and we tend to have more constipation issues than men, that we tend to have more urinary incontinence problems. So it can start just from like a little bit laughing, sneezing, coughing, because we are great multitaskers. We can laugh, pee, and cough all at the same time. And all the way to full-blown incontinence, where they just let the whole bladder out.
Okay, so is it primarily, though, a loosening of equipment problem, or are there other reasons?
Well, there's different types of incontinence too. So we have what we call the stress incontinence, but that's where you laugh, sneeze, and cough, jog, and just boom, out it comes. But there's also urge incontinence. You're having fun with this, aren't you?
I'm just thinking of it the next time I go to a comedy show.
Yeah, be very cautious. There's a lot of pads going on there. But when the urge incontinence is we're running to go to the bathroom and we hit the door to turn that key, and all of a sudden the bladder constricts and contracts, and boom, out it comes. And then you can have a little bit of mixture, or some women where their bladders don't function properly and they get what's called overflow incontinence. Men typically have more issues with some of the laughing, sneezing, coughing as well, so they can get different types, but all of it, typically the most common is the stress, where the laugh, sneeze, and cough. And that's where the pelvic floor is starting to drop, and it's usually because you either have interabdominal pressure from constipation over long terms of time. Those babies, I mean, having babies just wreaks havoc on our bodies, where everything just drops, and when the angle of the bladder is wrong, and it just makes it easier for that urine to come right out.
So when life's elevator says 3, 2, 1 pelvic floor,
exactly.
then you know that it may be something that affects almost everybody. Is that fair?
Most people at some point are going to have a little bit of urinary incontinence. It's highly unusual not to.
Okay, but what do we do, though? We were talking about changing the baby, and I know that there are a lot of moisture pads for women. Are there things specifically for guys?
Well, you have the pads for men and women. They just locate those little diaper areas strategically depending on our body parts. But they've gotten a lot better. When you go to grandma's house and it smells kind of funny, that's really bad old pads. But they've gotten better, so urinary smells aren't as traumatic, but it still can be problematic. But there are what we call Kegel balls, so if you want to get a set of balls, they can help most people.
Yes, please continue.
So the Kegel balls are round spheres that you insert into the vagina, and they cause the vagina to lift weights, in essence, which can strengthen that pelvic floor. There are pessaries, which look like donuts, which can be inserted into the vagina to keep things elevated. I know you're looking at me like, are you kidding me?
No. I was picturing, though, members of the audience saying, honey, listen, second cup of coffee, let's watch the Morning Scramble, because they always do things that are kind of fun. And they're making notes now.
Yes.
But you're talking about simple solutions.
Yes, so because ultimately you may require surgery, which lifts the bladder. It's called the bladder sling. But those should really be last resorts, because any surgery can be problematic. But Kegel balls, Kegel exercises, these pessaries, medications for the urge incontinence. There are all kinds of various things you can do aside from that, but you really need to be tested. And believe it or not, you can actually test women called urodynamic testing, where you go in, dynamic testing. So now it means your bladder is very dynamic. So you basically can have tests done, and we do it in our office, where you can look to see what type of incontinence you have, how bad it is, and then you can determine what the best treatment courses are.
Okay, it's only with Dr. DeRosa could I ask this question. Never even occurred to me until a couple of minutes ago. belly dancers do that whole big muscular kind of movement. There are belly dancing lessons around. Is that going to be of value?
Well, anytime you can strengthen the core of the body, that can be helpful. And what's interesting, we see often the opposite problem with belly dancers, Pilates instructors, cyclists, where they actually tone their pelvic wall so much that they get what's called vaginismus, where the vagina actually doesn't open readily and have difficulty with penetration. So anytime you lift that pelvic floor, strengthen that core, it can be helpful for one area, but you also have to be careful it doesn't go to the other extreme.
But you've got testing that goes on at your place, right?
Absolutely.
Talk about that.
So the urodynamic testing, so you want to go in and do a good physical exam. You want to look, because sometimes there's anatomical reasons that are causing the issues. You want to do a urinary test to make sure there's no underlying infection that could be causing a lot of urinary incontinence, blood work, and then urodynamic testing, which can actually go to that next level to determine what kind of incontinence you have and how bad it is.
So remember, when you're watching the Olympics, the only balls that are involved there are competitive. If you go to the DeRosa clinic, you'll find out that you don't have to say whoops quite as often. This is Pat McMahon. Stay with us.
I can't take my eyes off of it, moving so phenomenally.